The governor of Texas rolling back the state's reopening plan after a week-long spike in coronavirus cases. Bars are now being ordered to close and restaurants have to limit their capacity. NBC News reporter Priscilla Thompson joining us now from Houston. Priscilla, tell us about the governor's decision here and these new restrictions.
Well, that decision, Allison, was driven by the numbers. Just today, Texas hit a new record in hospitalizations, the 15th day in a row that has happened. Today, recording more than 5,000 COVID-related hospitalizations. And so we did see the governor beginning to show some concern for those numbers and also for the positivity rate. The fact that folks are testing positive for this virus at nearly 12%. And his sort of baseline threshold had been 10%. And so that's what he said in this executive order, that was what prompted him to make some of these changes today. So we're out here on Washington Avenue, normally a bustling area with lots of bars, but those bars are not going to be allowed to allow people inside their doors today. They're only going to be allowed to do takeout and pick up to go. And that has to do with the executive order that the governor issued this morning, saying that they would not be allowed to reopen. He's also scaling back some of what we're seeing at restaurants. Those restaurants are no longer going to be able to operate at 75% capacity, but he wants to see them at 50% capacity. And also gatherings, outdoor gatherings of more than 100 people are not going to be allowed to happen as long as these numbers are continuing to spike. And I want to read you a little bit of what he said in his order, specifically as to why he was placing these new restrictions on these particular businesses. He said, "It is clear that the rise in cases is largely driven by certain types of activities, including Texans congregating in bars. The actions in this executive order are essential to our mission to swiftly contain this virus and protect public health." And that's what we see happening here. It remains to be seen if these numbers continue to rise, if more restrictions are going to be put into place, or if we'll begin to see these numbers come down with these new restrictions and also with the new mask orders that a number of counties and cities have put into place in the past few days, Allison.
Priscilla, you said it. It's all about the numbers here. There are now more than 37,000 confirmed coronavirus cases in the Houston area. How are city officials there responding to the spike in infections?
Well, city officials are very concerned, particularly here in Houston, where we now know that the ICUs are at 100% capacity in the Texas Medical Center. And so we heard from the county judge and also the mayor today in full support of the governor's new executive order to close down those bars and to scale back some of the reopenings. And, you know, the county judge has also spoken about wanting the power to, as she had the power to in April, to actually order a stay-at-home order for her jurisdiction because of how quickly the cases here in Houston are ticking up. And, you know, folks mention the field hospital. Houston and Harris County does have the option to open a field hospital, which would create some extra hospital beds and more space. But I wanted you to take a listen to what the county judge said about that today. Listen in.
I don't want folks to see this as additional capacity that we have. NRG Medical Shelter is temporary. It is not long-term. And again, human lives are not collateral. The point is not to figure out how can we fill every single bed in this county and somehow still hope to be reopened. That is not a logical plan.
And you hear her there pushing back on this idea of reopening at any cost and saying, you know, human lives are at stake here and everyone needs to do their part. And so she's urging people to stay home. She has issued a severe warning here saying that folks do need to stay home right now, Allison.
Priscilla Thompson in Houston, thank you so much.
Thank you, Allison.
Dr. Doug Lawson joins me now. He's the CEO of CHI, St. Luke's Health System in Houston. Dr. Lawson, thank you so much for being here. Tell us, if you can, what you're seeing at your hospitals right now.
You know, across Houston, we're very concerned about this increase in the number of cases that are being diagnosed. Unfortunately, we've seen this just a drastic increase. Much of this can be traced to a lack of discipline around masking, hand hygiene, and appropriate physical distancing. All three of those are significant contributors to this current situation. Our hospitals are working together to make sure that Houstons have access to the care that they need. We have the physical capacities to care for many, many more patients, and we're working daily to make sure that we have the staff and physicians necessary to care for those patients. You know, early on in this crisis, we were also struggling with how to best care for the patients, what type of protective equipment to use, and how to train our staff to use that equipment effectively. We've learned much more about that. We've learned how to staff and equip we've learned how to equip our staff, how to create better inventories of those supplies. And this time we are in a much better place. We do, however, want to make sure that we have the staff necessary to care for those patients, and we're bringing people in from all parts of the United States in. You know, we're part of a large system, Common Spirit Health, and my colleagues from across the United States stand ready to help as we move through this process, and we are fortunate in that regard.
Dr. Lawson, we know that hospitals in Houston are preparing to increase their capacity. How exactly will you do that? And as part of that, bringing in doctors from other areas?
Doctors and nurses, primarily nurses at this stage in the game. We have many, many physicians here who are passionate and committed. We do need nurses, and we're bringing them in from all parts of the United States. We have a large group coming in today and early next week. And so that will go a long ways towards making sure that we have more than adequate capacity to care for the patients who need us the most.
We mentioned that Texas is now closing bars, bringing back some of its restrictions. What role do you think this reopening played in the surge that you're seeing right now?
You know, it's hard to connect the dots directly at this stage in the game, Allison. I'll leave that more to the politicians. But what I would say is we must normalize the use of masks. We have to make sure that we're maintaining adequate physical distancing, and we must make sure that we're reinforcing hand hygiene. Our service industries are particularly important in this regard. Those that do it best are gating their capacity. They are setting up hand hygiene centers at the entryway and requiring that patrons wash their hands and mask before they come in. Those are best-in-class examples. We need to do that consistently across the economy. You know, none of us want to see the severe shutdown that we had before. It hurt many people, and it actually hurt the health of some. What we're hoping now is that we can approach this in a slightly different way, but it means that each of us have to be more disciplined in our approach to those three areas: hand hygiene, masking, physical distancing.
We know testing is also so important. Dr. Anthony Fauci saying today that the administration is considering a new strategy that's called pooled testing. Can you explain what that is and if you think that might be an effective approach?
You know, our technical experts are always looking at more effective ways to do surveillance testing, testings of large groups of people who are otherwise either not showing symptoms and asymptomatic or healthy, to understand how the virus is spreading. This is one of the more recent methodologies that we're seeing. It's to be determined how effective it will be. But I'm certainly that we in the healthcare industry stand ready to support that as we move forward.
Dr. Lawson, I know you and all your doctors and nurses are working around the clock. Thank you so much for the work that you're doing and for taking the time to come and talk to us today.
Thank you very much for having us. Stay healthy and do well.
Thank you, too. The U.S. has confirmed nearly 2.5 million coronavirus cases, and now states like Arizona, Texas, and Florida are struggling to contain new infections weeks after they reopened. Here's a look at how the situation in those areas has evolved from May until now.
So today I'm issuing an executive order that outlines how we go about opening the Texas economy, helping you return to work using the safest standards to contain the coronavirus.
So we're going to have to watch it real carefully. I wish we had waited another week or two to get testing in place and contact tracing in place. But we're going to monitor it now. We're going to continue to do the things we can do, and I hope the governor's plan works. I hope that we don't get on those curves. And I'm going to do everything I can to help make the governor successful by wearing my face covering. And I hope other people do too.
Now, after blaming rising numbers on increased testing, Governor Greg Abbott changing course.
COVID-19 is now spreading at an unacceptable rate in Texas, and it must be corralled.
2 months after Texas businesses began reopening, a growing list have closed again because of the coronavirus.
This surge was both predicted and predictable, and it's really worrisome. We're looking now at almost a vertical slope in terms of the number of cases.
I cringe when I go out and see, people clearly that are just have gone back like nothing's going on, and I'm afraid that we're going to get to a point where all of a sudden everybody realizes this is bad, but a lot of the damage is done.
Today, though, Florida will take a step. Small, deliberate, methodical, and based on consultation with some of our greatest physicians towards a more hopeful future. This new phase will start on Monday, May 4th, and will, for the time being, exclude Miami-Dade, Broward, and Palm Beach counties.
There is a significant amount of the population that still is harboring the virus and doesn't quit. So if we were to go back to normal without using all these precautions, then there would be a massive second wave.
And I think we just...
Hey, NBC News fans, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here, and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.